Hello and welcome to my channel. My name is Peter Abraham. I am a registered nurse with cardiology, med-surg, long-term care and rehab, and extensive hospice and palliative care experience. If you're new to this channel, welcome. Thank you for visiting. In this channel, we discuss a variety of topics uh, focusing around holistic care, hospice and palliative care, anticipatory grief, grieving, hospice and end of life discussions, book writing, as I've been authoring different books to help nurses both from an holistic perspective as well as hospice empowerment. I write books for hospice caregivers as well as caregivers dealing not only with terminally ill patients, whether it be cancer or heart failure, but also those dealing with dementia. So I finally got the author's copy for the Dementia Caregiver Essentials. This is the largest book that I wrote, 532 pages. Most of my books are under 200 pages, not two. Oh my word, I can't speak today. But 532 pages going over a wide variety, how to help your loved one who has dementia wear a CPAP at night. There's planning legal and financial considerations, how to help them wear external oxygen, infection prevention, dealing with hallucinations, music therapy, so on and so forth. And the reason I'm talking a little bit about this today is Debbie, one of the people who I have part of the dedication for this book, second paragraph, texted me today. We stay in contact. It's been well over a year that I took care of her husband at home, sending me an article about Gene Hackman in terms of Alzheimer's awareness and dementia awareness. So I'm grateful. Before I go too far, in today's discussion, we'll be talking about the value of presence. We're going to work on value of presence from several angles, but also to give you an update on book writing. In every episode, I do like to go over areas of gratitude. What are we grateful for? And in terms of looking at when I last published, which was Wednesday, looking at how end-of-life doulas add such value to those who are dying. Hopefully those who are dying have hospice and palliative care involved, but there are times when they're not involved, and even when they are, death doulas add so much more value than I as a hospice nurse could ever add, because I'm only there for, now my visits were usually an hour to an hour and a half, an hour and 25 minutes would be about my ballpark average. Some of my visits would be 2 hours, but a lot of the death doulas are spending far more time with the family, with the patient, with caregivers, providing much needed emotional, spiritual, and just so much value that they're adding. So part of what I'm grateful for is I've been sharing, I'm still dealing with struggles. I'm still dealing with the form of grief, not only grief of losing my father-in-law, who was like a father to me, my mother-in-law, who was like a mother to me in the very recent years, but the loss of losing my job as a hospice nurse in June, the loss of like moving to Kentucky, and I'm grateful to be in Kentucky, but I have not yet been able to find part-time hospice or any type of registered nursing work, because so far in Kentucky, in this geographic region that my wife and I are living in, central Kentucky, are looking for 12-hour shifts, even for part-time workers. And I can understand why they're doing that, but I'm an 8-hour person. I'm a 4-hour person. I could do 10, but 12 is never 12. It is 12 and a half. It is 13 or more before I ramble, for which I'm guilty of. So I'm grateful for I'm finally coming to grips. I'm grateful for the community I live in. Every Friday, I go to a men's breakfast at a local coffee shop. And today it was just Chris and myself. Sometimes there's three or four of us, sometimes there's six. It varies from week to week, but it's just a way to get together and support and uplift one another. And Chris was so encouraging. Why don't I write a book sharing about the different stories that I've learned from my hospice patients, from their perspective, a way to give a tribute back to my hospice patients. So I appreciate the encouragement. I appreciate to be a part of the community. I did sign up to be part of the Medical Reserve Corps here in Kentucky. So that is a volunteer program where retired, semi-retired, and even working nurses can participate in this medical corps. So right now they're doing background checks that they pay for everything for this, just to get me on board, so that if there is a emergency of any type, I may be able to help and participate from that perspective in terms of my medical background. So I'm grateful for that. So, in terms of moving forward with this discussion, and I do encourage you, what are you grateful for? I'd like to talk about a book update and then go into the importance of presence. Presence from the perspective of self healing, presence from the perspective of if you have a loved one who is chronically ill or terminally ill, what your presence means to them. Even if you like, so much we're often doing, what do I bring them? What could I do for them? We forget our very presence has a lot of value. But before I go over that predominant topic, let me give you an update on books. So I did get in 2 author copies this week. I got in the Dementia Caregiver Essentials. This is a combination of 10 separate books, all in one, for less than the price of 3 of the books on Amazon. I did get in the author's copy of the Hospice COP. That COP is Conditions of Participation, not the police. Hospice Conditions of Participation Handbook. And I'm so grateful for the 5-star reviews that it has been receiving. What makes this book different, other than being published in 2025, when other books are 2008, 2009, 2013, 14, 16. There is one that comes close in 2023. And the Hospice and Palliative Care Organization will be publishing one this year. Is this book ties into this book without replacing this book. So this is not about how to implement hope, but it does reference where hope intersects the conditions of participation. So I'm so grateful for that, and it has been selling, for which I've been grateful for. So one of the books that I've been working on and off since October of last year is, I do have a 3-book set for holistic nurses. The very first book published was Dementia Staging Mastery. How to stage somebody's dementia even if they're not in Alzheimer's. Alzheimer's is the easier one to stage because we have the FAST, as in driving fast, but please don't drive fast. The FAST scale, which must be read linear, not skipping a stage. So you stop at the stage, you don't skip stages. You stop at the highest stage of go to the highest stage of functionality, come down one. This is how to, but what about Lewy body dementia? What about vascular dementia? What about Parkinson's dementia? So there are 13 known types of dementia. This goes over how to stage no matter their type of dementia. We have compassionate care and conflict, how to use validation therapy and other methods to reduce conflict. This is especially handy for those combative patients who have cognitive disorders, including dementia. And then we have motivational interviewing. So how do we bring out the self-motivation in other people? How do we get them to be self-motivated? So this book goes over that. So one of the books I've been working on and off since October, I took a break in October to work on and complete this. because this has to be implemented by hospital providers in the United States by October 1st of this year. Time is running out. Whether you use this book or other books, hope needs to be in place by hospice providers by October 1st. So I jumped on that ship, so to speak, to get that book out. But one of the books I've been working on is how can nurses use cognitive behavioral therapy, CBT, in practice to help our patients. Part of my goal as being an author is how do I empower you, my fellow nurses, to improve patient outcomes. A lot of us who have been in the field, I'm not in the field today, but a lot of us who have been in the field know that it's predominantly a school of hard knocks. I don't mean to ever demean somebody's level of education, but I don't care if you have a PhD, an MSN, a BSN, my BSN, an associate degree, or you're one of the old school nurses who graduated from a diploma program. That degree on the wall does not correlate to wisdom. And you can get wisdom one of two ways. Either you're going to get wisdom from this, what I call the school of hard knocks. I grew up in coal mining territory. Or you're gaining it from other people sharing and training you and helping you grow. And a lot of this is only briefly covered in nursing school. So I'm trying to write books that can be read and help you master different topics and bloom and grow and be the best that you can be while improving patient outcomes and hopefully reducing your stress levels. So let me walk you through a little bit of that book. Just walking you through a short section of a new book that I'm working on for my fellow nurses that will be part of the Holistic Nursing series. This is Clinical CBT, Cognitive Behavioral Therapy Applications, Essential Strategies for Modern Nursing Practice. This is a 10-chapter book, not including the introduction and conclusion. It is written in APA format with several pages of references at the very end. And there are currently 2 appendices, and that's probably where it's going to remain for this book. Every chapter we do have an introduction. We do have learning objectives, key concepts. Squiggly lines is spelling, but that is spelled correctly. Chapter 4 deals with trauma-informed care and crisis management. These are 2 areas where CBT, and I would also argue validation therapy, can be extremely effective. Chapter 5 of this book goes over how do you use CBT with motivational interviewing and validation therapy. But chapter 4, again, dealing with trauma-informed care and crisis management. For every area where it says here's a protocol or here's something to do, implementation steps are provided. There are various clinical scenarios. Tables are used to try to promote readability and to keep things simple and smile. I like the KISS principle worded that way, keep things simple and smile. Where appropriate, there are clinical alerts. There's approximately 75 clinical alerts for all 10 chapters. What are we really watching for and monitoring if we're working with something, especially when we're looking at trauma or crisis? What are the red flags and what do we do? Intervention strategies, again, like with protocols, here are the implementation steps. Here is a clinical scenario. Pearls of wisdom throughout based on information gleaned from other nurses who have been practicing CBT for many years. Safety planning when appropriate, Again, implementation steps, clinical scenarios. As I mentioned before, looking at clinical alerts. Clinical alerts are written in a way just to make you pop. We need to read this. This is important. We're dealing with something that we have to pay attention to in terms of providing proper care. And let me just scroll down towards the conclusion for this chapter. We have the conclusion just goes over what you've read. Every chapter conclusion has discussion questions, practice scenarios, as well as Socratic questions to reinforce learning. I know many of us are used to taking tests. This is another way to enhance learning, especially when you were talking about continuing education, where the nurse or student can take the test multiple times anyway. I'd rather have somebody let it sink in and learn versus trying to get a score. It's not a matter of how well you do on a test, it's a matter of how well you apply the material. So that's the book update. I'm hoping to have that CBT book published either later this week or early next week. Now let's talk about presence. I have been doing a lot of encouraging lately with one of my friends on Facebook. And I'm realizing, in a way, as a side note, as this ties into the last episode where we talked about death doulas, in a way, I've been a death doula without knowing it or calling myself one, because I have been working with several people over the past year and a half who are struggling with death and dying and just trying to guide them through the process. It's just I've not called myself a death doula and I'm not charging anyone for my time. If you're a death doula, don't give me the shame game that I haven't been charging for any value I've been providing. But for right now, I'm doing that for free. But Rebecca, like many others, and I do have permission from Rebecca to talk about the situation. I do try to be sensitive for what I share. What do I bring my dad? And it's about the presence. On compassioncrossing.info, I have an article about presence visits in hospice. One of the lessons I had to teach myself, we talk about the School of Hard Knocks, is I have a patient who has cognitively declined. They have dementia. They're mostly nonverbal, or if they are verbal, I cannot understand them well. How can I help them? I don't want to just go and take their vital signs and thank you and goodbye. I've worked for nurses uh, that if they were with a patient or family for longer than 15 minutes, it was too long in their mind. And the sad, I don't know how to word things because I don't want to knock people. She is a wonderful nurse, an amazing nurse. She's actually saved the life of a patient who came on the hospice who turned out to not be hospice appropriate. And because of her interventions where he did need medical treatment, that patient is alive, I believe, even to today. But she was one nurse that uh, anything but the patient interaction. And I'm a little bit of the opposite side. I'd rather be there and push boundaries to be there with the patient, the family, and the caregiver as long as they want me there. So when I say push boundaries, it's more from the agency end, doing how many visits do you get done today, and you need to be under certain amounts of time per visit. Like the one agency I worked at, they were trying to get me to be do no more than a 45-minute visit. You know, Medicare is a 30-minute visit. You should be minimum. You should be able to fit within 45. And I believe that I'm there for the family. We talk about improving patient outcomes. But before I go on too many rabbit trails I'm guilty of, I want to stay focused on presence. So I had to get away from, I did my vitals, my documentation is done, and then leave, which was my comfort zone, the push. But it's like, could I benefit them by just taking out my phone and finding something on Spotify or YouTube instrumentals that would be fitting, and just spend time? And what I found over time, no pun intended, that just being there blessed them. It wasn't about me, it was the presence. And so for Rebecca, who asks on a regular basis, what do I bring my dad? I usually bring him a mango refresher. Your presence. And I'm so proud of Rebecca. If you're watching this, I'm so proud of you. Because Rebecca has come so long over the past month and a half. We've only known each other a short while. And when I use the word know, I mean as well as you can from a remote perspective. I'm not trying to exaggerate the situation. But this is a struggle to go and see somebody that you love and they're not the person who you grew up with, who you knew for years, who used to laugh and sing to you and, sorry, the very windy around here in Kentucky, but laugh with you and smile with you. And when they're less and less interactive with you, that can be very daunting and very like, do I want to remember them that way? And I know there are times to turtle, to self-protect, and I will never, I mentioned before, this is a non-judgmental channel. If that is what you need to do, do it. But if you can get out of your comfort zone and go and visit somebody that you love, somebody that you care about, and bless them with your presence, you don't have to talk about anything. If silence is deafening from a point of view, put on some instrument. I prefer instrumental for these purposes, and put the volume low enough that you can just barely hear it, that it breaks the silence, but not high enough that if somebody in the room started speaking, that you wouldn't be able to hear them, or you had to go, I have to lower this real quick. It's not as awkward that way. But you have the presence for being present for others. You also have the presence for being present for yourself. And I've been trying to do that lately as I've been struggling with, where do I fit in Kentucky? I grew up in coal mining territory. My grandmother was my predominant parent. My grandfather was loosely involved in my life, but I would hear his stories about how, like, neither of them graduated from high school. They left high school, shouldn't even say high school. They left school at third or fourth grade. They didn't get into high school. They didn't get into junior high school. My grandfather was a coal miner, and he would share stories on how they would get blisters on their fingers, and it would just hurt so bad. And their fellow coal miners would just say, and this is going to sound weird, sounds weird now saying it, just urinate on your fingers. And that's what he would end up doing that after he got over the grossness of it. What helps. I'm not saying do that. I'm not giving medical advice. But here, when you grew up learning from them, and I learned the work ethic from them of just do. You have to be out there working. And so for me, not to have a regular paycheck. God bless my wife, Laura, she's, 3 days a week. Her boss asked her last week, can you do 4? She did 4 last week. I'm so grateful that she's working, but I feel like, what am I doing? And Nina Hart, who runs Hart, she's a consulting business. She helps hospice agencies with compliance, audit preparation. And by the way, if you're watching this and you're a hospice nurse, oh, survey's coming. And what do? I got a survey coming. How do I prepare? This is Nina Hart's specialty, Nenahart, Nina Hart. This is her specialty. But she was sharing on a recent video with her husband that she had to get over when she was employed as a director of nursing. That, I'm used to those gold stars. And not that we would receive gold stars from our employers, little stickers, but just hearing, like, I would get cards from patients and families. Thank you so much, Peter, for being my nurse. Or on LinkedIn, on my profile, there's cards from both families and from my managers that I've had over the years. Peter, well done. But when you're not working and you're not receiving any of that, it can be challenging. Where do I fit in? So for me, I'm learning to just be present in the current situation and not go out into the future, stay in the present. And I know some of you who are my regular viewers are not faith or religious based. And I do believe there's a difference between faith and religion. Religion's dogma. But before I go down a rabbit trail, but for me, I try to stay grounded in Christ Jesus, my Lord and Savior. So I'm trying to be present in His Word, trying to be present in what does He want me to do, and trying to be available and saying, God, what do you want me to do? That's part of the picture too. And part of that picture is, let me sign up to be part of the Medical Reserve Corps. And, I don't have paramedic experience. I don't have EMT experience. Certain things I don't know from being a hospice nurse for so long, but maybe God has a place for me there. And I continue to take continuing education classes. This week was a wide variety. I shouldn't say wide variety. I should say why did I say wide? Non-edited live recordings. But 2 of them dealt with appropriate medications, and then 2 of them dealt with pain management, including a well-done course from the United Kingdom. I do believe Europe has a lot over us on a number of different areas for hospice and palliative care, but again, trying to avoid rabbit trails. My encouragement to each and every one of you is 2 things. First, if you have a chronically ill loved one, especially if they've not been doing well in the past 1 to 3 months, or if you have a loved one who is on hospice, or you have a friend who is they're in a nursing home, especially if they're in a nursing home. It doesn't matter if it's personal care, assisted living, skilled nursing. Go and visit. Bring yourself, because it is your presence that adds the value. You are beautifully and wonderfully made. You are valuable. Your very presence is something to offer. And you may be surprised when you get there. And I am not a prophet, so I'm not going to say you're going to get there and it's going to be wonderful, because that's something that Rebecca has been dealing with. And again, I am so proud of you, Rebecca, because you've been dealing with it so well. And that is, you go and it doesn't go well. And your loved one's in pain. Or you were hoping that they'd talk more. But you're very present. And in the case of Rebecca, just if you're watching this, I am so proud of Rebecca in so many ways. And many of you don't know Rebecca, and you may not know, but there's always, where there's one, there's others. Where there's one, there's others. Every visit Rebecca has gone where things did not go well, thanks to her going, her presence, the nursing staff who may not have known, the hospice workers who may not have known, were updated. They were brought into the loop because Rebecca went. So the presence. So if you're going and something doesn't go your way, alert the staff. If you're going and something just doesn't feel right, alert the staff. And for those of you of faith, pray. We serve a God who answers prayers. And we may not like the timing in the book of Habakkuk. Why haven't you acted now? But he does work and he does answer prayers. And then the second thing is take time during the day, during the week, to be present for yourself. Give yourself grace. Give yourself forgiveness. Give yourself mercy. For everyone watching, thank you so much. Thank you for your time. If you like what you're seeing, like. If you have commentary, today somebody liked the thumbnail. How do I get a copy of that? And I looked up, there's actually a way that you can get a thumbnail right off of YouTube for that without having it elsewhere. Another person wrote over the doula saying that it's fitting, that doulas can be so valuable. We need them in addition to hospice. They're not a substitute for hospice, but they're so helpful. But comment. I don't mind trying to help if I can. This is not trying to sell you anything. I appreciate everyone who's buying and reading my books. Thank you so much. But if you have questions and I can help you and bless you in any way, shape, or form, again, disclaimer, not medical advice, not a professional relationship, one human being to another human being, I'll do the best I can. Thank you, God bless, and bye.